Kazakhstan is the 9th largest country in the world by area.
Total population is around 19 million people, while density is less than 7 people per square kilometer.
The historic Alma-Ata Declaration on the Development of Primary Healthcare was adopted in 1978. 40 years later, in 2018, more than 140 countries adopted the Astana Declaration on Primary Healthcare. The value of these events is in the commitment to principles of accessibility and quality of primary healthcare. Kazakhstan is creating a primary healthcare system in order to improve health of every resident. A basic set of health services is provided to one from birth to old age, from prevention to treatment. Zhibek Ermekovna's morning starts in the early dawn. Before the start of the working day, she has to finish all the chores around the house. There will be no time to do that afterwards. Zhibek Ermekovna is a village doctor. She's been putting aside her personal matters and rushing to help her patients at any time of the day, in any weather, for the past 28 years.
Ever since I was a child, I wanted to become a doctor. After graduating high school, I went to a medical institute. I got my degree in 1993. Those times were not easy. Kazakhstan was just becoming an independent country. I've had many opportunities to move to different cities, but I decided to come back and work in my home village. There were no doctors here at the time.
Здравствуйте.
Here's our new outpatient department. We moved here in January. It's become much better compared to the 90s.
Здравствуйте, Федоровна.
Здравствуйте.
Как дела у вас?
Пойдет, дела лучше некуда.
Хорошо.
I've been working in rural healthcare for a very long time. This year, we received this outpatient department as a gift. There is everything that is needed for the proper examination of kids, pregnant women, as well as the elderly. Our department is equipped with electrocardiograph, internet, and a telephone. We can easily contact our colleagues on the internet or by telephone to discuss certain methods of treatment for patients.
Kazakhstan residents understood the importance of primary health care during the pandemic. Polyclinics and outpatient departments were under huge pressure, providing COVID-19 response measures while treating people with other diseases at the same time.
6 new outpatient clinics were built in our district, which is similar to the one here in Shakhtar village. Last year, we received 12 ambulance vehicles and 1 critical care transport, which is equipped with modern equipment.
The well-coordinated work of primary care physicians and mobile medical teams who provide home care to patients has made it possible to effectively fight the infection and reduce the workload on hospitals.
These are the mobile medical teams created for a timely response. We handle calls by category of emergency. We're equipped with thermometers, pulse oximeters to measure oxygen saturation, blood oxygen saturation, and temperature. Also, we deliver drugs to those who are at home from the high-risk patient groups. Patients from high-risk groups have arterial hypertension, diabetes, or bronchial asthma. It's very important to keep these patients at home so that they do not endanger themselves and follow all safety measures.
Almost 4,000 mobile medical teams have been created in the country. 49% of them work in rural areas. They played a key role in treating patients with coronavirus at home.
This is a mobile medical complex, sort of a polyclinic on wheels, which is designed to provide medical care to the rural population in remote areas. The structure of this mobile medical complex includes an obstetrician-gynecologist office with all the due functions of an obstetrician-gynecologist appointment. This is an ultrasound machine and a place for conducting an ultrasound examination. This is where GP appointments are taking place. There is a child under 1 year old at the reception right now. Here is the place of the laboratory assistant. Also a distinctive feature of this complex is that you can provide assistance to patients with disabilities.
149 mobile outpatient clinics provide medical services throughout the country. They are equipped with everything you need for examinations and consultations. You can also get vaccinated against COVID-19 inside these medical buses. These made it possible to provide timely medical care during the pandemic, even to those residents who live in the remote areas of the country. Today, primary healthcare is a key aspect of healthcare in Kazakhstan. We pay special attention to the development of primary healthcare to provide access to medical care for all citizens, regardless of where they live. Thus, we plan to increase funding of primary healthcare and social assistance to 60% of the country's total health budget within 5 years. And today we see that primary care staff took upon themselves the main role in fighting against coronavirus infection, as they are the first and main barrier to prevent infection and improve population health. More than 4,000 doctors and almost 13,000 nurses work in rural areas. Rural health workers have a special status. Medical visits, home calls, preventing examinations compose not only every working day of rural doctors, but also their weekends and holidays. And here, one cannot do without love for the profession, a sense of responsibility and professionalism.
The profession of a doctor in rural area is the most needed profession because every person needs us doctors, and I want everyone to be healthy.